Hello, today I'm going to talk to you about the knee joint. And first, I would like to start off with what the knee joints are and what are the important structures in the knee joint. So, this is the knee joint. The knee joint has three places where the knee articulates. One is the patellofemoral, that you can see that this is the patella and this is where it articulates. So this is very important because one of the first symptoms of knee arthritis is the patellofemoral pain, and that happens when you bend the knee. That is because this and this joint are having a problem. The other common joint that has a problem within the knee joint is the inner side of the knee, and this is the medial side of the knee, and that is this particular joint. So the first problem that happens in grade 1 and grade 2 osteoarthritis, this problem and this problem is the most common, and that is why you have pain while bending the knee, and then slowly gradually the pain is on the inner side of the knee where it is arthritic and the problem occurs. And in the later stages, this is the third joint where the problem happens, and this is the lateral compartment where there is a knee problem. And this is the last stage when all the three compartments of the knee are involved. This is called as tricompartmental knee osteoarthritis, where all the three compartments are involved. Now coming to the ligaments of the knee joint, this is the medial collateral ligament. This ligament prevents the knee from going this way, and the lateral collateral ligament, and that prevents the knee from going this way. Then another very important ligament which gets injured during sports injury is the ACL, anterior cruciate ligament. That ligament prevents the knee from moving forwards. Third most commonest injured ligament that gets injured in the knee is the posterior cruciate ligament, and that prevents the knee from going backwards. So this ligament keeps the knee stable, the structure which gives shape to the knee joint. But this is, like, if you can see here, it is a circular structure which is the medial meniscus and the lateral meniscus. This is the meniscus, and this also gets injured. There's a very common injury in sports people is meniscus tear. Now this also causes a lot of problems. So when you bend the knee, when in sports injury, you can see that the meniscus is a cushioning structure which is there in the knee joint, and that, if it is torn, can cause pain, especially during bending the knee or while straining the knee. This is painful. And when the meniscus tear is complex, during walking also the pain is present. So this is basically what the knee joint is all about. Now I would like to touch another topic, that is osteoarthritis. Now that we have understood what the knee joint is, osteoarthritis. What is osteoarthritis? Osteoarthritis basically involves damage to the cartilage of the knee joint. This, which is like a cushioning structure, and thereby also damage to the meniscus. So this is osteoarthritis. Now osteoarthritis is divided into 4 stages, from stage 1 to stage 4. Stage 1 only involves in the arthritis of the patellofemoral joint, and the pain is present only on knee flexion. In stage 2 and stage 3, this is something like a moderate arthritis, where there is involvement of the patellofemoral as well as one compartment of the knee joint. So 2 compartments of the knee joint are involved in stage 3, and in stage 4 all the 3 compartments are involved. The treatment in stage 1 to stage 3 lies with injections, where we have the gel injections as well as the tricot or the steroid shots. These help in reducing the pain. Another very important thing, when we have a unicompartmental or a bicompartmental problem, today we have the robotic joint replacement, where we replace the patellofemoral joint as well as when we replace the medial side. This is called as a robotic partial knee surgery or resurfacing surgery. So this can also be done up to stage 3, and this has fantastic results where you can even play all kinds of sports with doing this surgery. For stage 4 arthritis, where there is a deformity or where the knee is bent, the only option remaining is knee replacement surgery. This can be done either the robotic way or can be done the conventional way, but these are the only options. So this is how a knee arthritis progresses, and these are the options available at different stages. Now, a lot of people start wondering when we have a knee arthritis that let us do things which are non-surgical and which have other options. Now, and in this situation, a lot of people go to other non-surgical branches where they try to, or no, non-doctors who are practicing different alternative medical therapy. I would urge everybody that there is no final solution to stage 3, stage 4 arthritis other than finally going in for surgery. You can only prolong your problem, but don't go for non research oriented or therapies which have not got any backup or have not got any studies to show that they actually work. There are a lot of things where they put bandages, there are a lot of ointments, there are a lot of massage oils, there are a lot of these things which actually give you relief, but they will give you relief for a very temporary moment. It is not for a long term benefit. The long term benefit does not lie in these alternative therapies, especially for knee arthritis. And sometimes I see a lot of people who come from very rural areas, from villages, who have been treated by quacks, and they have been told not to undergo surgery, and finally they reach a situation with osteoporosis where the bone has got a lot of, the calcium has reduced, the bone has weakened a lot because they have been going through these alternative therapies and being given these massage oil, thereby causing osteoporosis, as well as the deformity of the knee has gone so high that they are unable to walk, and finally they do need to undergo knee replacement surgery. So these are the people, I do urge them, avoid going to alternative therapies for this particular problem, because it leads to complications in certain situations and does not help in improvement. Thank you.